Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. Today's a very special show because we very rarely have one guest, but you all know him. I certainly have known Dr. Zachariah for, well, I can't tell everybody, but it's 4 decades. And he is a preeminent interventional cardiologist, affiliated and associated for many years with his brother and his sister-in-law. He is now at Imperial Point Medical Center, which is on Federal Highway, just north of Commercial. It's exciting because I understand that the new program that you're being involved in and building at Imperial Point Hospital will bring about a venture which I think is so needed in the South Florida region. But I'm going to let you tell everybody. Welcome, Zachariah P. Zachariah, Dr. Zach, as I always call you. Welcome to our show.
Well, thank you, Dr. Lippman. Again, I want to congratulate you for doing a fabulous job making Nova Southeastern University the Mecca for medical training in the southern part of the United States. You have done an incredible job.
Thank you.
And I'm honored to be here. I'm excited for the new opportunity to start a heart program, all facets of heart program at Imperial Point Hospital. It's a great institution, great staff, great nursing, and I'm really, really looking forward to working and building a class act heart program at that institution.
I understand that you're going to have, at least I've been told by some of the individuals, that you are going to have a chest pain center.
Yes.
So you want to explain to us what that is?
Yeah, a chest pain center is when a person complains or feels chest pain. They need if they come to the emergency room or they come to the hospital as an outpatient basis, we can do the necessary testing to make sure where the origin of the chest pain is from. A lot of the people, when they have chest pain, believe it's coming from the heart. Sometimes the pain may not be coming from the heart, but sometimes when people have chest pain, they may think it is indigestion and don't really take care of it, and actually as a result of an impending heart attack. So these are patients that we'll evaluate and do the necessary testing to find out the cause of chest pain so we can treat them appropriately. And it's an undertaking, it's a multidisciplinary approach. We need nurses, technicians, nuclear medicine people, and cardiologists, and even internists to make sure they are being properly diagnosed and treated. For example, prevention in heart disease is very, very important. So this chest pain center will evaluate patients who has chest discomfort or various forms of chest discomfort and come to the conclusion what the cause of it is and treat it accordingly.
I remember the last time we spoke, almost 2 years ago now, we spoke about the indications, which a lot of people, like I said, it's not always chest pain. You related to the fact that general cardiologic care, and we know that people should visit their cardiologist, particularly after certain age and certain indications, a minimum of once or twice a year. So let's talk a bit about that.
Yeah, they have done studies on people who have experienced sudden death. That means they died suddenly and they were successfully resuscitated. About 50% of them, or close to that, will tell you they had some symptom before that which they thought was not from the heart, was related to either lifting some objects at home, or they had an extra drink, or they had some spicy food, or they felt it was from the gastrointestinal tract. Or sometimes the discomfort from the heart can go to the jaw, between your shoulder blades, usually to the left arm, but it can go to the right arm. It could be tingling, numbness. So most of the people, when they get a tingling or numbness in the arm, will relate to some cervical disc problem or something like that. Or sometimes when people move objects at home or change their car tire, whatever some strenuous activity they did, they always blame it on something like that and don't get attention. So one of the most common symptoms, other than chest discomfort for heart disease, is unexplained fatigue. A person suddenly finds out he or she is just fatigued for no rhyme or reason. Of course, you always blame it on something. But if you have unexplained fatigue, then you really need to get some attention. The other symptom is if you get difficulty breathing when you exercise, or you get dizzy, or your heart is beating rapidly, a palpitation or irregular heartbeat, or some kind of discomfort which is unusual. If you have some symptom that you never had before is unusual, they must get some form of medical attention to make sure it is not coming from the heart. Because once it affects the heart, if you get, unfortunately, the consequences are grave. You can die suddenly or get a massive heart attack. And once the damage is done to the heart, majority of the time it cannot be. Some can be reversed, and some of them cannot be reversed. So the thing to do is, if you have any unexplained symptom, whether it's fatigue, difficulty breathing, numbness, you must get medical attention.
Tell us what an interventional cardiologist is.
An interventional cardiologist is a person who has his or her training in internal medicine for 3 or 4 years, then has training in cardiology for 2 years, dealing with ultrasound, examining the patient, stress test, and all the ancillary procedures to make the diagnosis. After that, he or she has to spend either 2 or 3 years doing heart catheterization and other interventions in a heart catheterization laboratory. It has to be certified and properly trained. And most of the centers today require to spend 2 years, and a good number of them require you to spend 3 years in the laboratory doing heart catheterization. For example, when I was at the Cleveland Clinic in Ohio, we all had to not only work for 2 years, we had to do a minimum of 150 procedures on your own, not with assistance from someone else. Today, I think the number is about 100. In some institutions, in order to get the board certificate, in order to be certified by the board, you have to have a minimum of 100 cases, to some instances 150 cases, that you perform independently, not with the assistance of your supervising physician. So it takes a long while to learn the process and be confident in performing at least 100 to 150 procedures. Now, the heart catheterization is one part of intervention. The second part of intervention is doing angioplasty or putting stents inside the heart. That also, you have to do a minimum number of patients to be proficient. In order to be certified, in order to pass your boards, you have to do so many number of patients and be proficient in that, and should be certified. Just because you did it don't mean a thing. Your program director has to certify that is his or her opinion that you have fulfilled the minimum requirements.
How do you get to an area where you know there is a narrowing of certain vessel structures in the heart?
So what we do is we pass a catheter or a hollow tube with a puncture of your artery in the groin, which is called femoral artery. Once you puncture the artery with the help of a guide wire, under X-ray fluoroscopy, you enter the heart. You enter the blood vessels of the heart. Once you enter the blood vessels of the heart, you inject iodine dye and take some pictures. Then you can locate where the significant blockages are. Once you locate the blockages, where the significant blockages that needs correction, and there are methods to find out if the blockage is significant enough to be fixed. Once you make the determination, and you have the consent of the patient, then what we do, we pass a very fine guide wire, which is very extremely the size of about 4 or 5 times the size of a hair, is very flimsy. You got to pass a guide wire across the blockage first and stabilize it. Then you pass a balloon. You insert the balloon into through the blockage and dilate it. And majority of the cases today, we leave a stent, which is probably made of titanium. We put a stent to keep to remove the blockage and keep the artery open. And it takes a lot of skill. It takes a lot of understanding of when to do and when not to do. And we want to make sure the patient really requires the procedure.
And again, today it isn't just you as an interventional cardiologist or the cardiovascular surgeon or the other cardiologists that are involved. It's a team approach. And I would assume that at Imperial Point Hospital that they're going to have a new, what I would call a multidiscipline operating unit that's going to be there, so that you're not there alone. Because if you need, it's not, I use the word intervention, but if you need the services of a cardiovascular surgeon, it's all going to happen.
Anytime if you do a diagnostic test, it's okay. Anytime you intervene to do an intervention, you have the whole team of the heart surgeon, the anesthesiologist, the pulmonologist, all those physicians and the top-notch nurses, critical care nurses, they all have to be participating in the process as a team. And we are building an excellent team at Imperial Point Hospital with superb heart surgeons and anesthesiologists and other nursing personnel. We are one of the finest nursing personnel in Florida. And we have, as a group, all of us have to work together. It's a multidisciplinary approach. And we are in the process of having that done at Imperial Point.
That's what we used to know as open heart surgery, the replacement of valves, things of that nature. Just talk about that for a while.
Yeah. See, when you do coronary stenting, actually is done close to 1 million patients today in the United States. It has significantly reduced the number of open heart surgeries. Open heart surgery in selected patients is extremely helpful and should be done. But majority of the patients can be fixed with a stent, with angioplasty and a stent. The complications are much less because it's a invasive procedure but not a surgical procedure. The complications are less, the hospital stay is much less. The incidence of infection and other complications are much less because you don't, in majority of the procedures, you don't have to put the patient to sleep. The patient is sedated, but they're awake during the whole procedure. As a result of that, the hospital stay, for example, angioplasty patient comes in the morning, have a stent and go home the next morning. But if you're an open heart surgery, you got to stay in the hospital between 4 to 7 days, depending on how complicated the case is. So it saves a lot of the productivity is significantly increased if you do one of the non-invasive procedures. But again, it's a team effort to accomplish that.
No question. You know, also the last time we saw you, we spoke dramatically about the new influence of nutritional counseling, of hydration, of a lot of the factors that help or prevent cardiac disease. I wonder if you would once again communicate to our viewers some of your feelings. I mean, I know personally, because with all due respect to the people, what they know or not, you and I have been dear friends for a long time, and I know how well you take care of yourself and how you chastise me every once in a while about how I'm to take care of myself. But the reality is that there's so much that response that we got from the audience when you spoke about proper nutrition and proper hydration. So maybe we can get into that.
The most important thing in preventing heart disease, incidentally, genetics is an overriding factor.
Oh, yeah.
But there's nothing much you can do about it. But having said that, even with the bad genetics, if you change your lifestyle and if you discipline, you will live longer. No question about that. The end of the day is all about discipline. When it comes to nutrition, it's about discipline. The most important thing is to exercise 4 to 5 days a week and stay on a good nutrition. Because people drive their car right in front of the office and they don't want to walk. In New York, you have to take the subway or you got to walk. And so obesity is very common in the United States. So the most important thing is to fight obesity. How do you fight obesity? By discipline, eating less food. And you should stay away from things in high cholesterol and from a cholesterol standpoint. But weight is a big problem because cholesterol, you can always take some medications with cholesterol. But the weight, there are no medications that's really helpful. So discipline is the most important thing. So you got to consume less amount of calories. At the end of the day, it's all about calories in and calories out.
He said, try to shop the outer edges of a supermarket first, because that's where the healthy stuff is. It's the, you know, but you made such a strong point about nutrition last time. and also hydration. You made a big point about hydration. That you know, we have people in the state of Florida, as you say, because of the manner of the cars right in front of your condo or right in front of your house. You don't walk to any place. You know, you get into the car and you go 2 blocks away and you go to CVS or Walgreens and you pick up your prescription. Why not walk there and walk back? But it's a social issue which I don't think we can deal with. But generally, if people would exercise, and they don't really understand it, not necessarily that you have to go into a fitness center. There are a lot of things, like I remember I reviewed your last broadcast and you talked about how simple little things like picking up soup cans and, you know, sitting there, and you talk about sitting properly and things of that nature. I don't know whether you remember, but that's what you were talking about. But really, exercise, nutrition, hydration. You also mentioned something about making sure that you had enough leafy green vegetables and fiber. So are we back? We're still
Yes.
in there, right?
I think that the most important thing is the diet, exercise, and we want to make sure they get enough sound sleep. Sleep is very important, especially in elderly population. It's important in all ages, but especially in the older population, sound sleep is very, very important. I come to the same point again. It's all about discipline. For example, I had a patient of mine other day. He said, I said, why are you getting putting on weight? He said, because I like ice cream. I said, what is your wish? He said, I wish I could eat ice cream for breakfast, lunch, and dinner. I said, I have a deal for you. He said, I will put you on an ice cream diet. You can eat ice cream for breakfast, lunch, and dinner. I'll make you lose 50 pounds in 6 months. He said, really? How do you do that? I said, you can have 1 tablespoon of ice cream for breakfast, 2 teaspoons of ice cream for afternoon, and 1 teaspoon in the evening, and that's all you're going to eat for the whole day. Sure, you lose weight. It is not what you eat, it is how much you eat. I had a patient of mine who lives next to a McDonald's on Commercial Boulevard, west of US 1. He eats at McDonald's every day for the last 15 years. But the man lost about 60 pounds because he doesn't eat the French fries. He doesn't eat the ice cream. So just because he ate at McDonald's doesn't make you put weight. I totally agree. It's better to shop when you go shopping on the periphery of the supermarket, not the middle row. But the problem is that it boils down to discipline, the quantity of food that we consume. And because when you tell a patient exercise, which they don't like, you tell them to don't eat all the carbohydrate, which they love. So you tell them to do something which they hate, and tell them not to do something which they love. So it's very, it's tough. It takes a lot of determination, and it takes a lot of willpower to do it. And I tell most of my patients, if you want to really lose weight, you got to make up your mind that you want to do that. And it starts when you go grocery shopping. The food doesn't walk into your house, you buy it. So just don't buy them. If you don't buy them, they're not walking into your house. If they did, they'll be famous. And they have to be disciplined.
Okay. Let's get back to Imperial Point Hospital, because now you're creating a new program there. Just tell us, I mean, you've already told us basically what's going to happen, but it must be very exciting for you.
I am really excited. I'm really, really excited to do it, and they have a wonderful administrator, wonderful staff, wonderful nurses, and I'm really looking forward to putting together a great team at Imperial Point and make it one of the most successful heart programs in the Southeast. I know I can do it. And we have a great staff, and I'm looking forward to working with them and accomplish the goal of having a great cardiovascular program at Imperial Point.
Well, that's great. I mean, I know everybody wishes you well, but I mean, I know all your patients that you've worked with and worked on, and past and present, wish you nothing but the very best. I'm sure that before you made this decision to move to Imperial Point, knowing you, you negotiated not only for yourself, which is minimal because you don't usually do that. You usually when you negotiate for the better of all. I've known you for so many years, and really that means that the patients are going to get extraordinary care, and I would assume that that's what you're demanding.
Yeah, in fact, the staff at Imperial Point is very tuned to that, and the most important person in the whole equation is the patient. The patient has to be taken care of, and his or her needs should be met. And incidentally, I'll be still working at both. I'll be still working at Holy Cross and Imperial Point, but I'm going to concentrate on building a program at Imperial Point. But I still will be working and doing procedures at Holy Cross till the other one is totally materialized.
Right.
And the patient is the most important person in the equation.
Well, that's the most important person we have. The viewers are the patients, and the reason that we've been, I guess, on the air over 16 years, because somehow we're giving them information which they're looking to get answers for. And that's why I always say to them, they got to take good care of themselves, and part of taking care of themselves is communicating with their doctors, so that when they go to see Dr. Zachariah and his cardiology team, they're going to ask a lot of questions. Well, don't be upset by the questions they ask. Just give them the information, because all you're trying to do is to find out how you could make their lives better, and particularly their quality of life. It's not only longevity, but the quality of life. And that's why I'm glad that you're here today, and I'm glad that that you are at this point in time of your wonderful professional career, putting yourself into a position of trying to improve the opportunities for those folks out there to have a better quality of life. And I will say thank you to you in behalf of the people who are viewing us. So thank you.
Thank you so much.
Thank you for being here. I don't know the exact address, but Imperial Point Hospital, like I said, is on Federal Highway.
It's just north of the 62nd Street.
Right.
That means about a mile north of Commercial.
Right. It's a mile north of Commercial. All right. And it's on the west side of the street.
That's correct.
That's right. Remember it well. Long story short, again, folks, you asked for information about cardiovascular and particularly interventional cardiology. There isn't anyone that I could think of, so I said, well, let's see, there's someone around here by the name of Zachariah P. Zachariah. So he's setting a record. He's the only person that has ever sat singularly with me 2 times in 16 and a half years.
Thank you.
But hopefully the information that you got today leads you in the right direction. Remember, talk to your doctors. Your doctors will help you. That's what they're there for. It's a different world, folks. It's a different world. And you have the opportunity to have the care of someone like Zachariah P. Zachariah. Thank you very much.
Thank you so much, Dr. Libin.
Thank you. I hope that we answered some questions that you asked. And remember, there's a telephone number and an email address right here. If you have any questions, just give us a call. We'll forward them on. We'll try to get the answers for you. And remember, this show is your show, so if you have any other further questions, just let us know. As I said early on, you got to take good care of yourself. And if you take good care of yourself, then you make me happy. This show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you. This is Fred Lippman from Dateline Health. Here's a health tip from Nova Southeastern University.
Adults are recognizing the importance of a smile and that their smile is an investment both personally and professionally. Today we're going to talk about orthodontics. Dr. Glenn Krieger is with us to explain more about orthodontics for both adults and children. Dr. Krieger, is it ever too late to get braces as an adult?
Thank you, Denise. It's a great question. It's never too late to get braces if you don't like your smile. Nowadays, we see many adults who, in contrast to children, really are more concerned about aesthetics. And so we can offer them a lot of different things today, such as clear aligner therapy, braces on the tongue side of their teeth where you can't see them, or traditional braces but ceramic, which almost appear invisible.
Is it harder to move adult teeth instead of children's teeth?
Well, adult teeth do tend to move a little bit slower than children's teeth. However, at the core, the way we move them is identical.
How do you know when a patient needs orthodontic treatment?
Great question. Certainly we want to look for things that any parent can see: misaligned teeth, a crooked smile, a lot of crowding, or maybe even a baby tooth that's still in the mouth when the adult tooth is coming as well.
When you have braces on children and teenagers, do you ever see a change in their personality?
It's wonderful to see how adolescents in particular can come out of their shell. Children are always gregarious and outgoing, no matter what you do. But with adolescents, you take off their braces typically when they're about 15 or 16 years old, and suddenly they become these really effervescent, amazing kids.
How would you know if you need braces?
You see your general dentist first for an examination and cleaning to make sure the teeth are in good shape, and then give us a call. Consultations are free, and the worst that'll happen is we'll say your kid looks wonderful and doesn't need braces. At best, we may be able to do something to change their life.
For Nova Southeastern University College of Dental Medicine, I'm Dean Linda Neeson.